Welcome to Global Medical Office Dialogues. The Chinese Mainland, with a population of more than 1.4 billion people, faces a huge growing burden of kidney disease. Significant advances in nephrology have been made over the past 40 years in clinical practice, research, and academic development. Nephrologist Dr. Grace Yan, Chief Medical Officer for Fresenius Kidney Care China, is our guest today to discuss the challenges and future of renal care in China. Welcome, Grace. I'm glad to have the chance to talk with you today.
Thank you, Dr. Maddox, for having me here.
Tell us just a little bit about your background and how you got into medicine and nephrology.
I graduated from the medical school in 1992, and after that I was employed in the university hospital since 1992, and at the first 3 years I was the intern and grounded to internal medicine, and then I was trained as a nephrology specialist. After that, I was practiced in the nephrology for around 20 years. And I also do some clinical research and basic research. And I'm interested in the dialysis and the renal replacement therapies to provide the high quality service to our patients.
I'm interested, over those 20 years since you began your medical career and your nephrology career, how's the state of kidney disease care in China changed over that time? What have been some of the observations you've had over your career?
Nephrology in China was started in the middle of 1980s. At that time, I'm just student in the medical school, and when the nephrology at that time became an independent discipline. In the past 40 years, China has made rapid development in various aspects in nephrology. Also, we think that in my whole career, and it includes in the clinical practice, basic research, medical education, and so on. And some specific features of kidney disease in China were recognized. For example, like glomerulonephritis was the most common cause of ESKD, followed by the diabetic nephropathy and the hypertension. These are some different from those reported in other developed countries. In recent 20 years, the renal biopsy is widely performed in China, and among the cases diagnosed by the renal biopsy, IgA nephropathy remains to be a leading cause of primary glomerulonephritis. It accounts for around 40% of primary glomerulonephritis. And then the lupus nephritis and diabetic nephropathy are the most predominant among the causes of secondary glomerulopathy. So you may find that China participates in a lot of clinical trials in IgA nephropathy and lupus nephritis, as well as the basic research, and made a great contributions to the world in recent years. Though diabetic nephropathy remains to be the second leading cause, the rapid increase of diabetes predicts a future prominent role of this disease in China. In fact, we have already seen the increasing proportion of cases of ESKD caused by diabetes in recent years. Over 30% of incident patients in dialysis are diabetes, and it's more significant in elderly patients. And in China, we have the national registration system from 2010. Currently, there are 730,000 dialysis patients are registered, and patient percentage of the hemodialysis and the PD are around 85% and 15% respectively. Although almost all the patients under the different government healthcare programs and can get their dialysis treatment reimbursed, in recent years, the incidence of dialysis is still lower than that in other developed countries or regions. And this may be partly due to the limited resource of kidney care in some remote areas, although the government have already done a lot of effort on that. With the development of dialysis, the survival have already been improved. However, like the volume control, cardiovascular disease, and CKD-MBD are now the current major challenge in the dialysis patients. And also regarding the AKI, the early diagnosis has been widely educated in recent years, and the Akin and rifle classification are commonly used in practice in China now. However, there remains to be large number of acute kidney injury undiagnosed and untreated. TRRT are non-commonly used and is the most common initial dialysis modality in AKI. And every year, around 10,000 ESKD patients receive renal transplantation in China. Since 2013, the organ allocation is mandatory to be through China Organ Transplant Response System. This totally changed the status before 2013, which we usually use. Most of the donors are from the deceased donor, and the number of the living donor are increased a lot. It accounts for around 20% of the renal transplantation. So during these years, the communication between Chinese Society of Nephrology and the international community of kidney disease are quite frequent. It helps China make quick development in nephrology. So this is, I think, a big function of the China Society of Nephrology and the International Society of Nephrology. And we have both communicated a lot and learned from each other.
I want to unpack a couple of the statements that you made. One is, with over 700,000 people getting end-stage kidney disease care in China, what proportion of the population that actually needs care do you think that is? Do you think that's going to grow substantially still as access to care expands? Or where do you think you actually are in the maturity of getting people the care that they might need in various parts of the country?
Actually, I think the incidence of the dialysis is still low in China. And you can see, like in Taiwan, the incidence is much higher than in China. Currently, I think in recent 7 or 6 years, when the government published the whole country population insurance policy, and most of the patients, they can get the dialysis reimbursed. So the more and more patients can get their treatment when they are in the ESRD stage. So the incidence will be gradually, and I think will be stably increased in China. With this large population of dialysis, we also actually seeing some change in dialysis fields, like the cost of the ESKD and the age of the dialysis patients are increased, although it's still young compared to other countries. But when the China has stepped into the aging society, so the elderly patients in dialysis are more common, and this category of the patients actually brings some challenge to our renal care. We need to do some for them.
It's interesting to think about the aging population and the impact on renal disease care. I'm just curious a little bit about whether you think there are other contributing factors. You have a fairly high proportion of your glomerular disease is IgA nephropathy or other inflammatory diseases, and I'm curious about, in your research, whether you've seen any other trends related to the population dynamics. For example, in the United States, we have over 60% of our patients with end-stage kidney disease having diabetes. I'm curious what the proportion of background diseases look like for your population in China.
The first leading cause of end-stage dialysis patient is still the glomerulonephritis. And I think if you look at the national registration data, you can find actually the percentage of the glomerulonephritis is decreasing, while the other disease like the diabetes and the hypertension is increasing. I think the reason may have a lot. One is because we have the increasing of the population with diabetes and hypertension, and also the patients, the elderly patients increased. So in the elderly patients, the most common, the leading cause of the ESKD is diabetes. And the other reason is because in China, when some physicians, when they diagnose glomerulonephritis, they do not have like biopsy results, because some patients, when they are found to have already have the ESKD, they never know they have the kidney disease before, so they missed the chance to get the renal biopsy. So they actually don't know what's the reason of the ESKD. They just provide their medical history, like they have some edema, they have some the bubble urine, and then some physicians, they will diagnose this patient as the glomerulonephritis. So in recent years, this kind of the diagnosis have already decreased, and we asked the physicians are educated as this kind of the diagnosis will be unknown cause for the ESKD. So the trend of the cause of ESKD, you can see actually have some change in recent years.
Tell me a little bit about your early research. What was the first research? You've published many papers. What was some of the early research that you did? At what stage of your career did you do that?
I remember my first research is regarding the function of the electric microscopy in the diagnosis of glomerulonephritis, because it is around 22 years ago, and at that time, renal biopsy is a very new thing in China, and the electric microscopy is very expensive in China, and it is fantastic that we got the electric microscopy. And I'm also was trained as a renal pathologist. So at that time, I will go to the university and to use the electronic microscopy to diagnose the disease. So it's very exciting, actually. So this is, I think, in my third career when I was an intern. I think the quality maybe not so high at the time, but this is my first paper. So I still can remember very clearly about that.
It's fun to think back of those times. Your past as a renal pathologist, I'm sure, has been quite helpful in how you translate what you know from the disease states into clinical medicine. I'm curious what some of the challenges are that you face today in running these 23 facilities that we have in China right now, and what are some of the challenges that are in front of you today?
You know, in China, as a nephrologist, we need to know broadly on all the knowledge, no matter it's for the glomerulonephritis or the dialysis or transplantations. But during my career pathway, I am more and more interested in the dialysis, also the dialysis, the patient management. And then I transferred to the patient care in dialysis and also the quality management. And then I joined Fresenius more than 2 years ago. This Fresenius actually gave me a very good opportunity to provide high quality of the service to the patients and understand more about the patients in each clinic in China and to give them the consult and management to the quality of the service for our patients. But, you know, since the standalone dialysis is a new thing in China, some policies and supportive medical systems are not yet well established. We do meet lots of challenges in running 23 facilities. First of all, in the stage of building, it takes a long time to get medical license and even more difficult to get medical insurance coverage qualification. And this brings a big financial pressure to the company. And then in the running stage, due to the shortage of the nephrologists and the qualified renal nurses, it's difficult to recruit completely qualified renal care staffs in some provinces. So some positions can even be in vacancy for a long time in clinics. On the other hand, the relatively high turnover of clinical staffs was found compared to the government facilities. Because of long-time employment promise cannot be provided by our company as a non-government hospitals or non-government medical facilities. Also, the intensive competition in the market. And this requires us to train staffs up there on board by ourselves and hope them could growing up quickly. So this is very interesting work we are doing now.
You have obviously been managing many of these dialysis facilities in a complex growing market. I'm curious how you have, it's hard for us not to discuss COVID a little bit. How has COVID impacted the care that you've been able to provide?
Yeah, of course, COVID impact our service, and it's have some asked everyone to change their behavior and their knowledge on the patient care. But you know, in China, as the government have taken very great efforts on the COVID-19 control, so it's quickly be the high wave of the pandemic was very quickly controlled. But for our each clinic, we ask them all the staffs and each patient, they need to take care of themselves, prevent the cross infections. So we ask all the patients be screened at the entrance of the clinics, and they need to wear their masks during the treatment, and they need to keep their social distance when waiting for the treatment. And also, everyone need to take the temperature before they entering the clinics. So I think in addition of the government's efforts, each staffs also do their best to control the disease, and they encourage patients to take the vaccinations, although the vaccination are not all be available for ESRD patients because due to some vaccination places, some staffs, they are worrying about the complications of this kind of patients after they got the vaccinations. But still, we have some patients, they already get the vaccination. So all these kind of the efforts make a good results for our clinics. So till now, we have no patients be infected by COVID-19.
Let's end by just letting you comment briefly on what you think the future of nephrology in China looks like for you. Just give us a few thoughts on what you expect over the coming years.
The rapid development of China's economy and society has made significant changes in a lot of aspects, including the spectrum of kidney disease, the infection disease, and some new risk factors. So this brings China prevention and the control of kidney disease a challenge, but also a lot of opportunities. And in the future, we might use new technology such as the genetic diagnosis, wearable device, AI, and so on to carry out clinical and basic and translational research on kidney disease. And we also will have a lot of therapeutic and equipment technology be innovated, and so that, and also the public health education can be strengthened so that we can promote the disease early diagnosis and early treatment, and involve precision medicine and improve the patient quality of life, and how to improve patient care and promote patient experience is always the aim we are working for. I think the future is good, but still it needs our everyone's effort to work for that.
I'm here today with Dr. Grace Yan, our Country Medical Director and Chief Medical Officer for FKC China, and we very much appreciate her helping us understand a little bit about the state of nephrology and the path that medicine is taking with regard to caring for people with advanced kidney disease in China. Grace, thank you very much for being here with me.
Thank you.